day on the Dr. Oz Show. His death shocked the world. Michael Jackson's extreme measures for sleep.
What you're looking at now is death.
The drug at the center of the controversy.
Do you feel guilty at all? I mean, you helped bring this drug to this country.
It shows how desperate we are for sleep.
Dr. Oz exposes the dangerous epidemic.
It's the court case splashed all over the headlines. Michael Jackson and his desperate measures to get sleep. And his doctor, who is facing imprisonment for his controversial treatment. It was to be his big comeback, the launch of a new concert tour in London. But as Michael Jackson pushed his body to the limit with punishing rehearsals, he struggled at night with insurmountable insomnia. In the spring of 2009, Jackson hired Dr. Conrad Murray to care for him, which included administering powerful drugs that the singer used to get to sleep. On June 25, 2009, starting about 1:30 a.m., Dr. Conrad Murray says he gave Jackson numerous anti-anxiety drugs and sedatives, both orally and intravenously, to help the pop icon get some sleep. But nothing worked.
He continued to complain about he cannot sleep, and so after an hour I decided, well, okay, I'm going to give him a different agent.
By morning, Dr. Murray says the exhausted singer begged for a hospital-strength anesthetic called Propofol, a drug he'd hoped he could get Jackson to stop using.
3 days before his death, I started to wean Mr. Jackson from Propofol.
But about 10:40 a.m., Dr. Murray relented and gave him Propofol. Finally, about 11 a.m., Jackson fell asleep and never woke up.
Yes, sir. I need an ambulance that we have a gentleman here that needs help and he's not breathing.
Michael Jackson's death has put the spotlight on America's insomnia epidemic and the desperate measures so many people take to fight it. But what happens when one midnight sleep? Joining me is one of the first doctors to bring Propofol to the United States, Dr. Michael Roizen. He's been contacted, by the way, by experts on both sides of the case. So let's just start with the basics. What is Propofol?
Propofol is an anesthetic that you give intravenously. It only works intravenously, and it induces a coma that helps block pain and give you sleep.
And if you can, just because you've studied this so much, give me your expert opinion about why Michael Jackson died.
Well, I think Michael Jackson died because he had practiced, if you will, this intense routine. So he got dehydrated under the bright lights. You even got bright lights here. So he gets dehydrated. They get pretty hot. And then he had a whole bunch of other drugs on board that decrease respiration. So that dehydration means that more the drug goes to his brain, more the propofol goes to those respiratory centers. I think he stopped breathing because of that. No oxygen in the blood. The heart doesn't get oxygenated, so the heart has abnormal rhythms, abnormal beats, and he died.
So what I'd like to do, if I can, is show everybody what the prosecution is alleging caused Michael Jackson's death. And it's an animation, and it's pretty clear, if you look at the animation, what we think may have occurred. So you're trying to sleep. So when we fall asleep normally, thankfully, our lungs they bring air in, the heart keeps pumping the blood out. And, our EKG, everything looks normal. But doctors sometimes use something called Propofol to put you to sleep if you can't get to sleep. It goes right into your veins, right up to your heart, and up to your brain. Now freeze it here. Now notice that almost all the anesthetic is going where it's supposed to go, which is up to the brain to sort of put you down, put you to sleep. That's why we use it for anesthesia. But if Michael Jackson was dehydrated, which is what many have argued, that most of the blood, instead of being detoxified by the kidneys and the liver, most of this medication will go up to the brain. And let's run this forward now. Once the medication goes to the brain, it goes through the blood-brain barrier, it touches these neurons, that white material touches it, which is the anesthetic, and it freezes them up. Once they're frozen up, they don't regulate this breathing process, which normally lets the air go back and forth. And yes, you can collapse the airway, but what happens more with propofol is you actually will freeze the whole process. Nothing works. The lungs stick, the heart will stop very quickly, you go flatline, and of course what happens to your blood vessels, instead of being nice and pink, they turn a dark purple as no more oxygen can get out of them. And this is what death means to a doctor. Cardiopulmonary arrest. This is what we fear happen. And this is always a concern when you use products that are powerful, that could depress how the brain works and how it sends signals to your lungs. That natural instinctive signal that keeps us breathing all the time. So let me ask you the pointed question. Do you think Conrad Murray should go to jail?
Well, let me put 3 points. First, he practiced below the standard of care. He did that in 3 ways. One, he let drug available to Michael Jackson, which you should have never let available. He didn't monitor him appropriately. He didn't resuscitate him appropriately. Secondly, if he had done those things, Michael Jackson would have lived past that time. But the third is, does that rise to the level of criminal? It does in my mind, because even if he told Michael Jackson, I can't do this, I don't know how to do this, he then went ahead and did it. So I think it does that, but this is really what the trial's all about.
It is. And do you think that propofol is too dangerous to be used in the current way?
It is the best anesthetic we have, but it needs to be given by someone who knows how to monitor it and knows how to treat the problems. It's not a sleep aid.
Well, for me, the propofol argument, it's the center of this case, but for me, it's just a symbol of the bigger problem we're having in America, which is that people cannot get the sleep they want.